So let's get started. You're going to take your therapy balls and place them either on the PSISs, those are those bony protuberances on either side of your sacrum, or just a little wider apart, more into the buttock flesh. Then you can place your fingers on your ASISs. Those are the bony protuberances on the front of your pelvis. And with your feet on the wall, you have a little leverage to go into the posterior tilt, or the tucked pelvis, where my lower back is closer to the floor, and then the anterior tilt of the pelvis, where you can see there's more space between my lower back and the floor. So let's just link our breath to our movement. Go ahead and close your eyes. Take a breath in, let your belly and your ribs expand, and as you exhale, without squeezing your glutes or squeezing anything, just round your low back spine. And then do the opposite. As you inhale, let your belly relax, turn on a little bit of lower back muscles to go the other direction, anterior tilt. And we'll continue with that. Hopefully you feel the balls roll a little bit closer to the wall when your low back comes to the ground, and then you feel the balls roll slightly up towards the waistband of your pants when you go the other way. This is so small, this movement. So as you continue, lengthen the duration of both your inhales, but especially your exhalations. The long exhalations help with downregulation of your nervous system. On these last few rounds, notice how there's so many different ways you can do this. So I can push my feet into the wall to help create the movement. And then I can pull my feet down the wall a little bit to create the movement. Or I can use more muscles in my low belly and my back to create the movement. Okay, let's take the therapy balls and move them up just slightly. Remember when I showed you on the skeleton L5-S1, so where your low back begins and your pelvis, where your low back ends and your pelvis begins. We're going to do the same exact thing. An anterior tilt, so I let my tailbone drop towards the floor, and then a posterior tilt where I round my back into the therapy balls. Continuing with that, notice your breath. And there shouldn't be any pain or discomfort while you're doing this. This should feel good. So if it doesn't, you would want to use those inflatable air-filled balls instead of the rubber dense balls that I'm using here. You have all these thick, strappy muscles along the side of your spine called the erectors and the paraspinals and many, many more. And if you are sitting at a desk all day long trying to keep your good posture, these tissues are going to be tired. They're going to be tired of being stuck in one position, and they're going to be tired of dealing with gravity. So this is a lovely way to have a massage without going and paying for one. All right, we're going to take the therapy balls back down to the PSISs or just wider on the gluteal flesh. And I showed you earlier rotation of the pelvis. I'm using this ball between my knees. You don't have to use it. It's nice because it helps you understand that you're not moving your legs side to side. You're actually rotating your pelvis. So right now my right buttock is heavier on the ball and my left knee is higher than my right. And then when I switch, my right knee is higher than my left and the left buttock is heavier on the ball. I showed this movement standing up. It's the same thing, but now I'm lying down. In our daily life, we tend to be stuck in one rotation. For most of the driving population, I've observed that they tend to be stuck in this left rotation of the pelvis. It's not always the case, but this will give you some information which one you might be stuck in. For me, it's the left. And so hopefully by creating a little tiny movement and having the feedback from the balls, you're able to maybe get a little more movement where you don't have it and rein in some of the excess movement or rotation that you tend to collapse into in your daily life. Plus, it just feels so good to have the balls alternately pressing into these tissues. Okay, let's take the balls back up. We have them at L5S1. That's where your low back begins and your pelvis ends. This time, let's go up a little bit higher, so say L2, L3-ish. In garment terms, you can just think somewhere above the waistband of your pants. And we'll do the anterior posterior tilt, or the happy tail, sad tail. So here's happy tail, right? It's a bigger arch. And then you can exhale, use your feet on the wall to get the posterior tilt and the nice sensation of the pressure of the balls into those tissues. We'll do that one more time. Breathe in and fill up your belly and your ribs. And as you exhale, try to let the muscles soften into the therapy balls.